Three, two. Good evening and welcome to episode 10 already of the Nebraska Gentleman. I'm your host, Nedu Izuegbunam. Nedu Izuegbunam. It is Sunday, 7:44 Eastern Time. I'm out here in Connecticut in my usual podcast apparel, black hoodie, gray Nebraska sweatpants at my desk, cup of water to my left, and a phone in front of me to hear and record my voice. We got a special episode on tonight, diving into those topics I mentioned at the very beginning of this podcast era. Really, the first episode I mentioned topics such as mental health, race, mental skills, and then another one today being on physical therapy, which we'll have my good friend on here in a little bit to really talk about that and pick his brain on any tips he has in terms of rehabilitation and recovery. But first, I usually like to start off every episode with myself and guests asking, what's good in our life? So a couple of things are good for me. I was able to close one chapter officially in my life tonight, which was good, and appreciate the couple of feedback I got from two of my lady friends. And then I also really just did not do much this weekend. I got to stay in, worked out Saturday, um, went to confession after the gym. I also so after the gym Saturday, I went to Hooters for wings. I got a buy 10, get 10 free, which were delicious. I got General Tao or Sao, I don't know how you pronounce it. And then um, went to a new church I have not been before, and I get to meet with the priest and just confess all the things that have been on my mind since returning to Connecticut back in August. So it was really relieving and it felt like a cleanse in a way, just turning the page and being able to move on. And watched a lot of comedy this weekend as well as Cedric the Entertainer. If you have not seen that Netflix stand up, I highly recommend it. The guy, great reminder of why he is so damn funny. So again, I highly recommend watching that if you're looking for a new stand up to laugh at. What else? Went to church this morning, meal prepped, and I did a silly Sunday skit on certain questions and comments I've heard from people out here on the East Coast have said when I tell them I'm from Nebraska. So if you haven't yet, check that out and do yourself a favor and giggle a little bit, hoping there's something that makes you smile. But outside of that, it was just a very lazy weekend. There were a couple of things that I really needed to do. Not needed to do, but wanted to do. The deadline isn't here yet. But healthcare was one of them for 2019. And figure out my payment plan for my loans that start this month. The grace period is up, and I'm not excited to start that period of paying back, but it's got to be done. But outside of that, also went Friday. My apartment was hosting an event for Bright Nights. It's a Christmas light events or holiday events in Forest Park. It's an area in my former town of Springfield, Massachusetts, and this park just has a bunch of beautiful decorations of lights. I believe the theme was Dr. Seuss this year, so I took a lot of videos and pictures and snaps of it, and just nice. I went alone. The shuttle was filled with families and couples, but I went alone. Really just got to sit with my thoughts and kind of have that time to myself for the week, and it was nice. The only downside is that I lost a Nebraska beanie that I just got about a month ago during my time in New York at a Husker bar. And this is like the third or fourth beanie I've lost in 2 years. My Cubs one and now this. So if anybody's looking for a gift exchange idea that you want to do with me, that would be mine. But on the real tip, I believe I'll most likely get one when I go back. I want a Husker. I love Husker gear. I need one. So um, hopefully it shows up. But if not, the countdown is on, so I'm back home to get a new one. So that's basically where I have been since we last spoke on Friday, 2 Fridays ago. And so now, without further ado, let's get into the word of the week. So I don't know if I'm pronouncing this correctly, but I hope I am. It is Penelopes or Penelopes. Penelopes. It is Penelopize. So if any of you know how to pronounce that correctly, please call in on our phone lines, 1-800 Nebraska Gentleman. But until then, I'll just keep pronouncing it Penelopes. It is a verb often used to describe stalling or delaying, basically a fancy word for procrastinating. So an example of this, obviously what I did this weekend, which was not getting to my health care for next year and payment plans, but also for my friends in school. I know there are exams and finals coming up, and I encourage you to try your hardest to be productive and not monopolize, penalize, I'm sorry, and just kick ass. I don't miss this month while in school. It feels a lot better out of school. So I sympathize with y'all. I should say I empathize, but keep kicking ass and doing your thing, and the finish line is almost there. So again, do not penalize. Without further ado, let's dig in now to the next segment, the main course, if you will, to our podcast. We have a special guest. He is one of my best friends. He's a charmer. I also like to call him a Nebraska gentleman. Although he lives in Arizona now, he is a legend in our friend group. He's a great guy, one of the tallest guys. He's kicking ass right now in school. And you'll learn why I like him as he continues to conversate or talk with me. Without further ado, his name is the Ryan Cooney. Cooney, how you doing, man? Coon dog.
I'm doing great, buddy. How are you doing over there?
I'm staying warm. I'm in great professional gear with some sweatpants and a hoodie, and I'm blessed, man. So I'm not as warm as you are, I'm sure. What's the degree like tonight?
Actually, it's clear skies. It's only about 64, which for some of us, it's kind of cool, but for us, it's nice out. So I appreciate it.
Yeah, that's my weather right there. So Cooney, I start off each podcast asking 5 like quick questions, this or that questions for my guests, and you have to do your hardest to not really think, just speak on which one you like, okay?
Okay.
Are you ready for this?
Yes, sir. Fire away.
All right, here we go. So the first question, which type of pain would you rather have or ache? Stomach or back?
Ooh, I would probably have to say stomach ache.
Harder injury to recover from, leg or arm?
I'd say definitely leg.
Chocolate or vanilla?
I'm more of a plain Jane. I gotta go vanilla.
Gummy bears or gummy worms?
Gummy worms for sure.
All right. And then last but not least, Nebraska or Arizona?
In terms of living?
Yes.
Ooh, I'd have to go to Arizona. Sorry, buddy.
No need to apologize. I'm sure a lot of Nebraska people would agree, especially in regards to the weather and things to do. I just wanted to see what you had to say.
I love Nebraska. It's always home, but Arizona's a little nicer, I have to admit.
Okay. So, Coon Dog, tell me or remind me and others, how did you and I meet?
Oh, let's see. I know it was freshman year of college, probably back in 2010. I think we met through a mutual friend of ours, Garrett, I believe, and that's when I kind of met you, Shane, and Guillermo, and the crew basically all at the same time. But I remember we hung out a couple times our freshman year, either at Husker games or tailgates, things around campus. But I know we were pretty social back when we were in college, so I know it wasn't too early into the school year that we didn't meet up. Probably within maybe the first month and a half of being at school.
Yeah. Yeah, to be honest, Cooney, I'm glad you, because I feel like we definitely had a mutual friend in Garrett. I just don't remember how or where we would have met. I don't know if it was like a philanthropy, like a fraternity or sorority thing, because outside of Garrett, I just can't even imagine. I don't even know how you two met, or if you remember, but
I think it was maybe we met through like that Club Red deal that they introduced like our senior year of high school.
oh, okay.
Yeah, yep.
Gotcha.
And then, we just kind of met in college a couple times, but we had fun. We were friends for a while, and he kind of showed me you guys. But if I remember right, I think the first time I met you guys, I think it was either up in you and Shane's dorm room on the whoever it was thinking HSS who had the corner loft, or maybe it was Abel Sandos, but one of you guys had the corner dorm rooms and had all that space. It was just totally decked out in Husker gear, and I was thinking like, damn, these guys got it going.
Yeah, I think if that was Shane and I, it was definitely our sophomore year. But yeah, Shane's always had decked out rooms, so that could have been freshman year in Sandos. But either way, it sounds like it's been almost 10 years for us.
Yeah,
Can't believe it. It's crazy.
That's
to
crazy
think
to
of,
think
right?
about already. Wow. Yeah. Seriously.
But yeah, Ryan, I like to ask every guest before we get into the meat of the interview, and I'll sing it heading back to our karaoke days. Tell me something good. What's going on? What's good in your life right now? What's one thing you can share that's going well for you?
Everything's going really well as of right now. I'm currently kind of seeing job offers outside of. I'm finishing school up here in.
Let's go.
So as of right now, I kind of have a few job offers lined up, or at least in the works, to possibly see where my career might take me after I graduate. So I'm feeling pretty good about that. And otherwise, in the meantime, as of right now, I got a couple weeks off that I can kind of just enjoy the nice weather down here. Go hiking when I want, work out. Really just kind of live somewhat of a carefree life, at least for a couple weeks before I have to get back to the grind again.
Yeah, speaking of that carefree life, you just went to Omaha, correct? I mean, I want to say you visited Omaha and back home in South Dakota, right?
Mm-hmm.
Yeah, tell me about how that trip was for you.
It was good. Actually, I got to spend 2 weeks to go home. Got to see some of my family and my best friends from college. Just like Shane and all of them. It was nice actually. We got back into Nebraska, flew into Omaha. Even got to see the grandparents for a while. Take them out to lunch. Uh, I met my boy Adam up in Hastings and met with his family and his 1-year-old baby boy. It just kind of put in a realization like how quickly everything just changes in just 1 year. But um, besides that, went to Lincoln for the first weekend. Stayed with a buddy. Apparently, everybody went to the game against Michigan State when it was like I don't know, 20 degrees, 15 or 20 degrees outside, and I thought you guys were nuts. But I'm like, I'm gonna stay indoors.
Did you remember to bring a jacket, by the way?
I remembered, but I was actually on my way to the airport via Uber, and about halfway there, I realized I didn't have it in my bag, and I was like, "Son of a gun!" I have to like run back and grab that because that's probably the most important.
Yeah, it's been a while. You can tell for sure.
For sure. But no, the trip went great. Got to see my brother. Went back up to his place for a little bit. Spent Thanksgiving with my mom and dad. I'd say the one thing I really cherished was I actually got to see my best friend Matt Schultz. He just graduated dental school from Florida, and he now lives in Connecticut. He was my best friend growing up, and I unfortunately, I honestly wasn't able to see him for almost 3 years. If you remember, Nedu, you were there, but you remember when we were walking in the College World Series there, probably 2014, 2015 summer?
Yep.
You remember we went to that tailgame I told you my friend called me into?
Yep. With his parents?
That was him.
Yeah, he was a good guy. I remember
Yep.
him.
Yep. That was the last time I saw him, was that
3 years. Wow.
Yeah. So crazy, right? But
Everything feel the same?
Everything felt the same. I mean, we hit it off just as if we were, best buds again. So that's always nice, and appreciate that, no matter what life throws at you, you're always still, friends thick and thin to the end.
Yep. Yep.
But,
So Cooney, what I want to do now is ask you, can you share with us what it is that you are doing right now, and really what all that entails? So I know you are currently wrapping up grad school, correct? Can you share where and what program you're in?
Yeah, I'm currently a third year doctor of physical therapy student at AT Still University in Mesa, Arizona, which is just a suburb of Phoenix. As of right now, I'm actually just finishing up my clinicals. And with that being said, we actually go out to hospitals, clinics, home health, pending our situation or our clinical experiences that we're assigned to. We see different patient populations all day for 10 weeks at a time. So right now, I have a little bit of a break, but I will basically be picking up another clinical here in January, just after the first of the year. And I actually get to work in an outpatient neuro clinic, meaning I work with a lot of patients that have cerebral palsy, were, stroke survivors, Parkinson's patients, things like that. So we help facilitate a lot of fundamental stuff, as well as just helping out with daily necessities of living, such as, helping them be able to comfortably walk without pain, or helping facilitate, just everyday motions of like trying to get in and out of bed, walking, getting dressed, things like that. And the one thing I really appreciate is, like, in some of the clinicals I work at, you kind of see, you see that everybody kind of gets knocked down a peg or two when it comes to situations like this. So, I'm sure you know a little bit about it, but like strokes are a pretty big deal in America.
Mm-hmm.
And one thing for us is, with a stroke, it usually affects one side of your body, depending on where the stroke's at. But it's some people bounce back from it. It does take time, but some people bounce back from it very well. Some people take, a lot longer recovery time per se. So our job technically is to help facilitate and help try to retrain the body, get it back to performing optimally again. And I mean, that's, in my mind, it's a great thing to do. I love physical therapy, and overall, the reason why I got into it was I love how the body can heal itself. It can recover from, anything from a minor, stubbed toe to a broken leg. There's a lot of variations that happen, but I always think it was incredibly inspiring to see somebody overcome physical barriers or obstacles. So that's kind of what I'm doing right now. Like I said, I'm on a short-term break just with it kind of being the holidays and everything, but I have an outpatient neuro setting coming up here in January to March, and then before I graduate, I head out to San Diego for about 10 weeks to do I'm doing a sports clinical where I get to work with a lot of the athletes that are training for the NFL draft. So it's a pretty cool job, I must say. Like, in my background being in sports and working like with the Huskers, as you kind of know from my past experiences, and I do. Again, it's really humbling. I like the work that I do, and again, it's awesome. I love it every day.
So Cooney, it's easy to tell that you have a passion for this. And just to clarify, so the first of the last two clinicals is patients neuroclinic. So dealing with one of the examples you shared as our patients dealing with Parkinson's, and then the final clinic you have will be in San Diego at a sports clinic. Is that correct?
That's correct.
Okay. So with these two that you shared, have you ever worked with either of these populations before? I believe the San Diego one is really the most relatable because of how you shared, you worked with Husker athletes.
Mm-hmm.
But this one you have coming up in January, which is your birthday month.
Yep.
Are there any, is this a population you have past experience with?
I have actually. I got to work at a major hospital in downtown Phoenix here for my first clinical, and it was an eye-opening experience. Kind of fresh out of the gate from, all day learning stuff in the classroom, and then trying to apply that directly to a patient population in the real world. It's definitely an eye opener because I haven't had experience in that previously. Um, but I think the big thing is kind of seeing like the immediate effects. Like we saw a lot of patients that had motor vehicle accidents. Again, suffered a stroke. Um, have any conditions maybe diagnosed with like multiple sclerosis, ALS, or known as Lou Gehrig's disease. There's a lot of different variations that come into play, and it's kind of interesting to see how they all affect somebody's lifestyle. So for this next clinical that I'm doing, this outpatient neuro, the hospital is like the immediate effects. Within the first 2, 3, 4 days of them being diagnosed or having the incident that occurred. When I go to this outpatient neuro facility, that would be more like trying to work on the last 20% of the recovery. So as simple as they
Okay.
can walk, but they still have trouble walking long distances. They still have pain when they sleep. It's kind of the last bridge between being completely independent on their own at home.
Okay. So Cooney, if I'm, say I am a 44-year-old individual, I'm a month out from having a stroke.
Mm-hmm.
I'm 20% away uh,
Full
from
recovery.
really, yeah, from recovery, not having any, not needing any assistance, living on my own again. My kids are moved out.
Mm-hmm.
Um, what is one thing you would do with me to help me get to 100%, or to help facilitate me getting to 100%, and how long would that take?
Okay. Here's the thing. A lot of it depends on what the patient's goals are. There's some people that are just simply like, you know what, I feel fine. I can do everything in the morning by myself. I don't need any assistance. But maybe it's something as simple as if I wanted to go to the store and pick something, if I wanted to go to the store and get groceries, or I want to drive over to my friend's house so we can maybe go play golf. Uh, a lot of it depends on what their functional level was prior, and then what their goals are. So the big thing for us is when they come see us for that last 20% to fully recover, we're focusing more on the dynamic stuff, such as can you get up and can you walk around the neighborhood without using any devices such as like a cane or a walker. Can you go out and play golf all 18 holes without getting tired, fatigued, or feel like you're tripping or you're falling, like things like that. So we assist with a lot of balance, functional, dynamic things. In a sense, it's almost kind of like it's sort of like practice for like athletes, right? You can do the baseline stuff, but we try to push you to a point that you can do even more functional stuff, right? A lot of it is kind of working on those hobbies, and that's what kind of gives patients more hope. And that's a lot of people don't understand that. But let's say with the scenario you kind of gave me, let's say you're a guy that likes to go hiking, twice a week. You like to do 2 mile hikes at a time. Well, at our clinic, we work on balance. We try to work on, working on unstable surfaces, or trying to work on endurance and strengthening your legs. Right? Balance is usually a big thing, big component that we look at, just because after a stroke, many people might be able to stand up by themselves,
Mm-hmm.
but time after time, usually like when they take a step or two, or as they're maybe just walking through the house, sometimes they like just feel as if I can't feel my foot, and they take a step and miss, and they go down. Right? Not a very pretty sight. But our job is to help try to create that trust, help try to create that fundamental I know where my body's at all times. I can balance okay, so I don't fall over. I still use all my arms and legs just fine. Because a lot of the times, especially for the older population, right? So with your scenario, instead of saying 44, maybe we're saying 74.
Mm-hmm.
Um, Patients tend to just accept that they're not gonna get better, and sometimes they don't try, which in a
And
sense it's
yeah,
hard,
yeah,
right?
that must be tough seeing that, that kind of helpless attitude or feeling come along
Exactly.
when you're trying to work with somebody to really get them to where you think they could reach their full potential, but their attitude or because like you said, their age, it just really brings them down.
hmm I think there's probably two things to me that usually attribute to their successes. One, it's got to be their motivation or their support that they get through family and friends, right? If they fail to thrive, it is obviously much more difficult, right? Um,
Yes.
but I'd say the other thing too is having a goal. Realistically, a lot of people just want to go back to the way it was. Completely understand that. But
But
sometimes we like to overshoot it just a little bit. Let's say I just want to be able to go walk around. I want to be able to go walk around without having to worry. Like, okay, sometimes we'll push that just a little bit more. That way, we can prove to our patients that it's possible to go a little bit farther than you really thought. And it's
mhm.
nothing major to most people. Like through our eyes, if it was as simple as like just getting up to go walk around, around the house without any assistance, like we won't even think anything of it, right? It's just a normal thing for us.
Yes.
But for them, that might be a huge accomplishment. So
Mhm.
perspective is a big thing, but again, that's kind of where you have to at for our job. That's a big deal that we have to get buy-in for our patients and explain the benefits of what we can help with them.
Yeah, and Cooney, I feel like you just illustrated another reason why you must love what you do, because you guys, it sounds like you really help them get to the next level. So you have a goal, but I wonder what it'd be like if we were able to not only get you to that goal, but get you beyond that. And imagine how happy you're feeling now. Imagine how you'd feel accomplishing it and, really exceeding all expectations. And that's got to feel extremely gratifying to see that as you're facilitating their progress and supporting them with their work. So,
Absolutely.
and another thing you mentioned too was how you kind of work first, like on the hobbies. I believe that's what you said. So that I imagine helps build the rapport and that trust for them to work with you because they're doing stuff that they like, and it's not just anything that feel maybe the hard work. It's actually stuff they enjoy, and I imagine you do that purposefully because it's all help motivate them to really kind of work and get going on those things that they were able to do before.
Exactly, exactly. I mean, it's kind of sort of the same similarities like when you're teaching younger kids about a subject, right? You make
Hmm.
it fun, you make it interesting, and they're going to want to participate more. It's
Right.
right. Nobody wants, a lot of people have stigmas of any place they go to, whether it's like the dentist, physical therapist, chiropractor, wherever that might be. But at the same time, like again, you need to have some buy-in or at least show some appreciation. Like, listen, this is what you want to do. I'm gonna help you try to get to that, right? Um, and here's one thing to do, and I think a lot of people, unless they went through physical therapy, probably don't know. Um, so let's say you might have had an accident, maybe when you're working out, you hurt your knee, right? You go to your physician, they say, hey, you have a torn meniscus, you have, something's going on with your knee. I'm going to write you a prescription for some pain medication. See me in 2 months if it doesn't get any better, right? You
Hmm.
know, you see your physician for, I mean, realistically, what, maybe 10, 15 minutes tops,
Yep.
right? Physicians have a lot more caseload, and I'm not dogging anything on physicians. They do great work. But for us, um, like when you come in the first time for an initial evaluation,
Yep.
averagely we give you an entire hour. Like you tell us everything that happened, what you're feeling, what you're able to do, what you can't do, what makes it better, worse. right? We kind of go through everything with you. So I think a big component that a lot of people don't understand is we're usually there for you for anywhere from a half hour to an hour every time you come in. And it's usually just one on one. So, I think a lot of people just like to be heard. Like, you know what?
Yes.
I've had back pain for several years. Like, okay, well, tell me about it. Give me all the ins and outs. And I mean, sure enough, we're diligently doing our job, but we're also listening. And I think that's what a lot of people just like to have that comfort that someone's actually able to just sit there and listen to their issues or conditions or problems.
Yeah, Ryan. And a conversation you and I had at the time when I was in grad school, because you and I had similar paths, going to UNL and then now
Mm-hmm.
in our own graduate respective programs. There was one thing you shared that I remember you saying that we have similar, we have similar fields in the sense that you work on the physical side and I work on the mental.
Mm-hmm.
And a lot of the things you're sharing are things that we were taught too. And even the vocabulary you use, such as the caseloads and spending that hour with the client, how important that is, because like you said, a lot of people just like to be heard. And not
Yep.
only that, with what you were sharing about the made up character I made before, you said really getting to learn what their history was like before the injury, what they enjoy doing, because all of that is so important in building that rapport.
Yes.
So, with saying that, I want to give you one last scenario, and this is coming off the dome. This is coming in hot. So, as I'm telling you, I'm also thinking of it at the same time.
Okay.
So, say you and I are, we just got hired to work with the same collegiate team. Let's just say it's our alma mater, Nebraska. We just
Okay.
got hired out of grad school. Um, I'm working with them one on one, building mental skills, and you're working with them one on one, helping them recover and get back on the field after an injury that put them on the disabled list or injured reserve, whatever. So we have an athlete, senior, just injured prior to the baseball season.
Okay.
Um, he running down to first in the team's last practice before opening day, he pulls his right hamstring.
Mm-hmm.
Um, I'd be curious to know what your work is with him. So I say I refer him with his consent on confidentiality, sharing that I'd like you to talk to the physical therapist Ryan Cooney about what happened. I'm too afraid to tell coach.
Mm-hmm.
So he's now ready. He now sees the benefits of talking to someone else about this and building his going to rehab and recovering so he can compete for the second half of the baseball season, his senior year.
Yep.
What is it that you plan? Just hearing that, obviously, we know the benefits of learning him outside of his injury. So, what is it that you would say or do in the first session, and what do you think the plan will be moving forward? What is it that you really want to ask him, and what would you suggest moving forward to him recovering to 100%?
Mm-hmm. With a scenario such as that, I think a big proportion is so you have to be realistic and understand the concept of, okay, what are we physically able to do for him?
Yep.
What is his mindset at? And then at the same time, like, what's the future hold? For a senior baseball player just before opening day, right? This is kind of the last go around before either you try to go to the majors or you're done for a while, right?
Right.
So a big thing that we do is we also try to encourage. We always try to be optimistic, right? So we look at this, and I mean, we'll also be realistic at the same time. Like, listen, from what we see, depending on how severe it is, this might maybe last, 2 to 4 weeks. It might last 6 to 8 weeks. It could last maybe just a little over 2 months. Okay. But the other thing too is you have to be realistic and say, listen, I know this might not be the greatest, but we're going to make the most of it. So usually when we start out, we work a lot with pain management. A lot of people become apprehensive after, moderate to severe injuries, such as let's say a torn hamstring, or whether it was maybe like in baseball, if they tore their UCL, their ulnar collateral ligament, now they have to have surgery. There's a
Right.
lot of things that happen, right? And there's only so much that also we can do to facilitate that. real quick side note, like, 10, 20 years ago, when someone like tore their ACL, like say in football, they got full casted from hip to ankle, and they wouldn't move for 6, 8 months, and then back to the time they were actually like fully running would almost be a year and a half.
Wow.
Nowadays, like Adrian Peterson, I think was one of the quickest. I think 4 or 5 years ago, he was back on the field in almost 6 months, or 5 months. Like, it was crazy. So I think that's one thing that we also have to educate our patient or our athlete on, is like, this is the time frame. There's a fine line between not doing enough and then overdoing it, right? A lot of athletes are like, give me whatever you need me to do and I'm going to do it. And I'm like, that's great. And I want that from you. But at the same time, you can't overdo it, because that's going to cause just as much damage as if, you let it just slowly take control and heal on its own.
And possibly even worse, it could extend the time, I'm assuming, correct?
Exactly. Yes.
Yeah.
So our job is to kind of find that silver lining as to everything in moderation, right? We want to push you, but to the point that it's something controlled and something that isn't painful. So usually we start off with, we do like soft tissue massage. We try to get rid of all the edema, the swelling, the bruising. And we try to work on just simple range of motion, or making sure that we still stay flexible and still maintaining some adequate strength. Okay. As the swelling decreases and we start kind of getting out of that inflammatory phase, we start moving into more healing of the tissue. So making sure that the hamstring's still strong, that the muscle tissue is healthy. We don't have any, scar tissue or buildup that might hinder his ability to still perform. So we work on just some basic stuff, such as just, trying to bend over one leg at a time, or doing anything from simple as just like body weight squats, like very simple things. And then as we kind of progress towards the end there with the recovery phase and also return to sport, then we start adding resistance, or, more body, or not more body weight, but more weights as we're doing just fundamental things. So it's usually a progression of managing pain first, okay? Trying to get rid of that inflammation, just as if like you sprained an ankle, right?
Mm-hmm.
Try to get rid of that. The second part would be making sure that we appropriately facilitate healing of the muscle tissue. So adequate, usually adequate movement, or, for instance, with this hamstring issue, we like going and just having you walk around the track maybe 2 or 3 laps, right? Something pain free.
Yeah.
That's the big thing. And the other, on top of that, is if we can get patients to buy into what we do or what we're selling, right? Listen, all I want you to do is just take three like very easy laps around the track. Did that hurt? No. Okay, then we kind of know where we're at, what he can tolerate, and where we can go forward.
Yep.
And on the same track, say if he did the same thing, he goes, no, that really hurts. Great. Now we just know something that doesn't work, and that's fine. Everything is always a learning curve, no matter how you take it. So with our job, a lot of it's very subjective. We have to look at, okay, how do they perform? When does it, why are they performing like this? When does it give them issues? Things like that. There's a lot of different factors that run into it, but the biggest help is usually the patient just telling us straight up.
Yes.
Okay.
Yes, and that's what I wanted to get to too, Ryan, is that it sounds like honesty, not on just your part of really telling them realistically, okay, this happened. It is possible you could be out the rest of the year, or, we have seen players bounce back from this. However, I think it's important that I'm honest with you. I think it sounds like hearing the honesty from your point of view, but also them, is very vital, because you need to know exactly what they're coming in with to better help them recover to the like you said, hopefully optimum level, not just how they were before, but even better.
Yep.
And you need all that honesty, it sounds like, because if not, then you could end up getting them actually worse than they were off before they came in.
Yep. And it, time and time again, athletes that want to win, or athletes that are very driven in their sports, in college, it's kind of like a business, sad to say, or just really like any sport. But, we also know from experience, let's say if this happened to you, and, you say you feel fine, I mean, we can tell, like, just the simple things of how you walk, how you carry yourself, watching like your facial expressions, like, say you hit a shot to right field, and as you're running the first, you just run a little bit more different.
Yeah, maybe grimacing too. Yeah.
Right. I mean, we can still tell, like, if it affects you, even if you say no, it doesn't. Like, just with anything, a little experience goes a long way. But for the most part, we know exactly what you're capable of. So, and just like anything, when you go to the doctor and they ask you, have you, done this or had this in the past, and if you lie to us, most of the time we're gonna find out anyway. So there's really no point in like trying to, kind of shift the truth to the saying like, yeah, I'm fine, I can play. I love the spirit. Don't get me wrong, that's amazing. But at the same time, you're an investment just like everyone else is. And if you're not 100%, then you're really just kind of hurting your own chance. So
Exactly.
I get it. It's a again, it's kind of a balancing act. When I interviewed for the Seattle Mariners here last January and February, I was telling you about, I kind of had that same scenario, and there's really no right or wrong answer. Regardless, there's just wrong, and there's just not as wrong, really.
Yeah.
As weird as that sounds.
So Cooney, now you have me curious. I thank you for guiding me through that scenario. It was kind of personal for me because I don't know if you remember, but I went to you last February or January
Yep.
with my own hamstring
Yep.
injury, and you shared your suggestions, and one of them was getting on a bike or just doing something to move a little bit. But like you said, not to a level where there was any pain.
Right.
So my question for you now, because like you said, you like those athletes that are really driven and want to do anything they can and are receptive towards your advice and everything. But can you share, obviously without giving any names or even the team,
Sure.
can you share an interaction that just went awful with an athlete? Like maybe they weren't giving in or they weren't sticking to the plan, and then how you were able to eventually, hopefully, get back on a productive, cooperative level with this athlete.
Okay. I kind of have one better for you. It's more of
Okay.
a scenario I actually got asked during a job interview at one point, and I'll be honest, it kind of stumped me for a little bit because again, there's really no right answer. It is an ethics question, but let's say an individual did get hurt, at practice, and with, let's say this is kind of in the big time, right? This would be up in the professional level of sports, but say somebody gets hurt, you know, they say they're fine. You obviously know they're not 100%, right? But you're kind of on that borderline, like they could probably still perform, but it wouldn't be very pretty, obviously.
Mm-hmm.
So now the question comes into, well, again, thinking of it as a business aspect, every player is an investment to the organization in which they're playing
Yep.
for.
Yep.
Let's say, for instance, if I did decide for them to play, and let's say they got hurt even worse or did more damage, or basically their performance tanked to a point where it was obvious that they should not have been playing. Now that kind of falls back on me and my job saying that, yeah, they were fine, and now the organization is going to come to my butt because I
Yeah.
didn't do my due diligence as to monitor that patient better. Okay. Now on the flip side, let's say I'm like, you know what? I'm sorry, but I gotta hold you out. I can't let you play. Now you have issues of like, well, hey man, this is my only shot. If I don't, I'm gonna get cut. I won't be able to do this again. What am I gonna tell my family? It's a hard issue to deal with, and I think about it like it's a business at the end of the day, but you still care for people. And again, business and just being just straight up being human to someone, right? Having generosity and still empathy and for everybody, it's hard to
I
balance
imagine.
both.
Yeah.
So the other scenario was I tell a player, hey, no, you can't. Your arm, your shoulder, your leg, you're in a condition in which you should not play. Okay, well, they could turn right around and be like, you know what? If you're not going to let me play, then the whole clubhouse is going to hear. Then all the other players get apprehensive because they know if they see me, then they're probably not going to get to play. So they hide every little bump, bruise.
Oh, okay.
And it's it's hostile because if for some or even some reason, let's say the initial player that I said, listen, you can't play, he might kind of he might turn around and also tell everyone else like, hey, listen, this guy's not, this guy isn't gonna let you play, like,
Yeah.
whatever you do, gotta hide it, just expose it, whatever. And
And now
so
your reputation's affected. Yeah.
exactly, your reputation's affected, everything, for the business aspect, where I'll be honest, man, I don't want to keep you out. My job is to make sure you play. And that's what I think a lot of people's misconception comes in where, I think a big thing is like youth football out here where I'm at. Kid gets hit pretty hard, right? Feeling dizzy, a little, disoriented. Like everyone immediately thinks he's got a concussion. You know, it's my job to kind of rule in like safety wise, like, can he still go? Does he need to go to the emergency room? What? Um, my piece of advice is listen, like, there's so much for sports, and I have respect for the game, but I always feel like, live to fight another day. And that's kind of the way I like to see it professionally in the business world of sports. That doesn't always apply, but especially for some of these younger kids that are like, I have to play. I mean, look at it like this: like, if you were playing a regular season, let's say it was a basketball game, right? And let's say you really messed up your ankle. Is it really worth going out there to play a regular season game, or would you rather save yourself for the chance that your team gets to play in the postseason, and now you're fully healthy and you can do everything you can. So,
Bingo. I
um,
mean, you're really just saying the words "play smart," play it smart.
exactly. And that's just the thing is I like your drive, but seriously, be realistic, right? Give yourself some time, and then we can do it again. Okay, like we can always readdress that.
I like it, Cooney. Um, so my last question, because you got me thinking a lot, and there's a lot of um, my inquisitiveness, if that's even a word, is very my curiosity has very much increased since this conversation. We can talk more off air, but I'm curious to know what is a tip you'd give somebody listening, say they're an undergrad, and they're interested in helping athletes on the physical side. What's a tip that you would give them on their path to, really eventually being a professional physical therapist?
I'd say for one tip is I think hands down experience is probably the most important thing I could ever tell anybody. Being that you've, let's say, read every book, understand every condition, disease, symptoms, that's great. I mean, I think that we need people like that, but at the same time, to answer the hard questions, you have to physically do it or be in that situation to fully understand the circumstances that come with anything. So kind of that same scenario I just sent to you, like, you know, you just told a professional athlete like, hey, they can't play. Well, now they have the situation with, okay, so my family doesn't get paid. I might get cut. I
Mhm.
might not get to play again. This has been my dream, you know, or I tell them they can play, and now the organization is on your butt because they potentially got hurt, or you might possibly cause
Yep.
an investment to be lost. So there's a lot of turmoil that can always turn out from that. But the best thing is, think logically. If you were in that person's shoes, right? What would you do, or what would you say? Um, Again, experience hands down. Nothing could ever be experienced, and that's just really anything with life for me. So,
Okay. Coon Dog, what's the most frequently asked question you get as a physical therapist, whether that be from the injured athlete or just an athlete on the sidelines or from a coach or anybody curious about what you do? What's the one question you get asked all the time?
I can't say as there's like a specific question that I get asked, night and day, but I always get people that kind of tell me like, "Oh, you are, you're so and so." Well, hey, I got this thing around my shoulder, my back, which I kind of laugh because usually it's always something unique, but I always take the time at least to listen to everybody and at least give a little advice or feedback as to what would be a smart option to do. Um, one thing that I'll kind of promote our profession, but there's a lot of states that allow direct access, and what that means is a lot of states in the U.S. Instead of going, let's say, to your physician, like you said, you messed your knee up. Well, I mean, no, duh. I mean, you know that, right? Okay. You can actually skip the process for some states. You can actually skip the process of going to see your physician and coming directly to a physical therapy clinic where we're able to diagnose, give you a more accurate representation. And
Really?
again, yep. And again, not discrediting anything from
Yeah,
physician,
yeah.
MD, right? But realistically, we're kind of the musculoskeletal movement experts, right? So again, you messed your knee up, maybe you got back pain, whatever that case may be. There are plenty of states, Arizona is one of them, which I'm lucky to be in. But we allow direct access, meaning you can come just directly to our clinic and we'll help you out without having to go to your primary care physician or your PCP and have them, basically write you a, prescription like, yeah, you need to go to physical therapy. I'll be honest, like most people, like, well, no, duh, thanks a lot. Like that's $100 I still have to pay you for. So I think I think the big thing for me is, oh, why should I choose physical therapy, or why can't I just, like say, go to the chiropractor, go see my physician? Um, I think the real big things I like to sell them on is we spend usually a little bit more time, usually a half hour, an hour for every session, one on one. Okay, we look at overall movement, and that's a big thing. Is especially when you get older, a lot of people stop moving, and I get, you worked your butt off your entire life. Sometimes you just want to sit down and relax and enjoy it, but um, it's been shown the less you move, the less likely you're gonna break 80, really.
Mm,
So movement is life. That's a big term we like to use, but
okay.
uh, but yeah, I mean, other than that, I think a big thing is a lot of people don't fully understand benefits in which we can provide for them. And again, it's usually a lot cheaper than maybe going to like your orthopedic physician right away. A lot of people, I have back pain for 2 or 3 months, and immediately like I need to get surgery, and I'm like, well, realistically, probably not. Um, so I think that's a big component, is just educating patients and populations as to what we can provide as a physical therapist, and also just some added benefits. It's cheaper. It's a lot more patient focused, and we're also going to be your coach basically the entire time. So instead of just going to the doctor once, right? We'll see you multiple times, in which we actually see the progression. Right? We're going to be there with you if you want to be there with us.
Yeah, Cooney, I feel like, man, do I have a huge, a whole different outlook on your profession. And now I'm very appreciative that you gave us that insight to just a lot of the work you guys do. And I'm learning that. So the one tip you did give that was very important is the experience.
Mm-hmm.
It's great to know, be knowledgeable of stuff, but actually having experience doing it is a key factor. And then also, you shared that, um, just it's not just the getting them to recover that's important. It sounds like the relationship, like mental health, is huge too. And I think that's another benefit. It sounds like working with you guys is that you're not just getting, my advice, suggestion, skills regimen on how to get better, but you're also going to get somebody that actually cares
Mm-hmm.
about your well-being and you becoming a healthy overall individual, and that's awesome. So thank you for taking that time to explain that. So now that part of this is over, I want to get into the quote of the week. So
Sure.
I found this online. I can't remember exactly where. I believe it was on my Facebook, and I do not know who to credit this, but it was a picture, and it said, "How cool is it that the same guy that created mountains and oceans and galaxies looked at you and thought the world needed one of you too?" So again, I'm going to repeat that. How cool is it that the same guy that created mountains and oceans and galaxies looked at you and thought the world needed one of you too. So, again, if you're someone out there, it's very easy to get frustrated and maybe question. It could be somebody you're with or something you're going through, and maybe your worth or esteem, whatever it may be, remembering that you are, you have a heartbeat and you created for a reason. So hopefully everyone listening, you're able to keep that with you through your downtimes this week and really beyond. So um, that was a quote of the week. And Cooney, before we wrap up, is there any last things that you wanted to share on your first appearance on this podcast?
In all honesty, I was humbled to be asked by Nedu to come by Nedu to come do this. But yeah, this is first time being on a podcast. So again, more than
You did
appreciate
great, my guy. You did great.
I appreciate it. It's been fun, and I hope there's many more to come. I've never done this, so I thoroughly enjoyed it. Thank you, buddy.
Thank you, Cooney. And the one thing with you, just saying that the reason I said his first appearance is because I'd like to have you on again. I'm going to wrap up season 1 here, I think, after the 15th episode when I'm home in Nebraska. You went about a week or two ago now. It'll be my turn at the end of this month. And I'm really thinking of how I want the next season to be, and I want it to be really hands-on. And one question I have for you, don't worry about, how I could feel. I really want your honest opinion, but there would be an episode or two where I'd like to post online asking asking listeners a question during the week saying, are there any injuries or anything you're trying to recover from that is tough right now and you're not really sure how to go about it? I'm planning on posting these questions to my friend Cooney on this next episode, and hopefully he'll be able to kind of help support whatever you're going through by offering just a minor suggestion. Would that be something you'd be interested in? Kind of like a Q&A with Cooney.
Yeah, absolutely. That would actually be that'd be terrific, really.
Awesome. Because I feel like with what you said, with what you shared today, I feel like we can go hours on this because there's so many more questions I had going in my mind when you were sharing just the process of when you're with these people and the questions that are important to ask and the honesty factor. And yeah, Cooney, I know I can speak for many people. We'll be interested on the road that you have going during this next semester and the path that God will take you after you're completed, because I know the finish line's almost there. And I know that any business would be lucky to have you as as part of their team. So please keep us updated on because I know you'll get some offers. So I'm going to word it in this way. Keep us updated on what offer you accept.
Okay.
And we'll definitely continue to follow you. But before we end, again, Cooney, thank you so much for taking this time. You're so lucky that you're on mountain time right now, 6:41. I love it. And beautiful weather too. But
Yeah.
it means a lot that you took this hour to talk with me and help people learn more about the field of physical therapy. So
Hey,
thank you.
anytime, brother. I appreciate you having me on.
All right, folks. That is it. Again, I apologize. We did not get Oprah again on this episode, but hey, we'll keep trying. So next week, we'll have a former college colleague of mine, Jeff Moulton, to talk nutrition. So this week we talked about the physical therapy, basically similar to mental health, but the opposite in terms of one-on-one going on the physical. Next week we'll talk more nutrition to help really motivate us going into 2019 to eat healthier and just live a healthier life. So again, thank you for listening to me and Coondog. And until next time, peace, love, and may your skills be with you. God bless and Kamesia.